Hey there, everyone. It's Dr. Justin Marcagiani. Welcome back to the Beyond Wellness Radio podcast. I have Dr. Bill Rawls in the house. Dr. Bill, I chatted with him about 4 years ago. So excited to bring him back on the podcast. We're going to be diving into topics all around cellular health. We'll talk about Lyme. We'll talk about a lot of other maybe potential chronic health issues and what you can do about it. Dr. Bill, welcome back to the podcast. How you doing?
Yeah, pleasure. Thanks for having me.
Awesome. Well, let's dive in. What's new in your neighborhood? I know you have some courses coming out. We were talking about that in the pre-interview. What are some of the things that you're inspired to do some courses on?
Yeah, just that concept of cellular wellness. I wrote a book recently that is out there called The Cellular Wellness Solution. And
Oh,
it's
cool.
looking at disease at that cellular level, which really simplifies things, makes it easier to understand. So I've served a lot of people with chronic Lyme disease. So I'm in the middle of creating recovery courses to help them go through that entire process, help them understand what's going on in their body and what the microbes are doing, and how that leads to those right recovery decisions.
Yeah, you're one of
Um,
the first people I saw come out with a kind of a chronic Lyme co-infection type of product. I remember it had the Japanese knotweed in there and some cat's claw and a couple other things. Do you still sell that product?
oh, absolutely. But it's not just that, it's a comprehensive natural program that includes a series of herbs, not only for suppressing microbes, but also immune modulation, cell restoration, and supportive nutrients to just bolster cellular recovery. So it's pretty comprehensive.
So when you say cellular recovery, like what does that mean to you? Does that just mean starting to get healthy, starting to incorporate healthy diet, lifestyles, principles? Like someone comes into your office and you're saying, hey, we're going to work on cellular recovery. What does that mean? What does the first couple of steps for that patient look like with you?
Well, it's things that most people are aware of: healthy diet, getting plenty of sleep, all of those kinds of things, but they don't think about it in that way. And what it boils down to is your whole body is made of cells. Everything that happens in your body, whether it's your heart beating or brain impulses firing or thyroid hormone being produced, it's all done by cells. And if your cells aren't healthy, you aren't going to be healthy. Any symptom you have is because cells are stressed or distressed in your body. And so the only true pathway to wellness is cellular recovery and restoration of cellular health.
That makes sense. And so when the average patient comes to you, what's the typical presentation that you're seeing? Because I know you were an OB doc for a while, right? 20
Yeah.
plus years. And so are you seeing a lot of female hormone cases with a lot of kind of chronic co-infections or chronic immune dysregulation? What's that typical patient that comes into your office look like?
Well, my practice has shifted quite a lot. I started my career in obstetrics and gynecology, but late 40s, I ended up struggling with chronic illness myself.
Mm.
Identified first with fibromyalgia, later was as chronic Lyme. Now I recognize that there's not a lot of difference between those two things, and ended up in my search finding herbal therapy as a
Mhm.
solution. Got well, did the things that I needed to do to recover my health completely. So after that point, which was like mid 50s, my practice shifted more to helping people in that pathway. So I've spent a lot of time really helping people understand hormone issues with menopause, et cetera. But a big focus of what I do is recovery from chronic illness, looking at that restorative pathway rather than the conventional medical pathway, which is mainly just suppressing the manifestations of the illness.
Yeah, so let's kind of do a little compare and contrast. Like someone comes in to see you, right? What are the typical foundational strategies when someone has chronic illness? What are the biggest things that you're going to do versus maybe the conventional medical doctor may ignore? Is it just maybe the conventional medical doctor maybe doesn't even see the chronic illness as an issue and it's like, let's just do band aid mode, which may be antidepressants, maybe a birth control pill if you're a woman with hormonal imbalances? What does that difference look like from someone like you versus the conventional MD?
Sure. Well, when you look at conventional medicine, the whole history of conventional medicine was built around acute intervention.
Mhm.
And for acute life threatening illnesses and injuries, a blocked vessel in your heart, a broken leg, any of those kinds of things, that acute intervention can be really, really important. But what we're doing in that case is basically stabilizing the injury. It's not, we're not actually doing the healing. The body is doing the healing. So when we look at chronic illness, that obvious cause, the broken leg or the blocked artery or whatever, isn't there. So when you look at multiple sclerosis and all the different chronic illnesses, Parkinson's, dementia, they're considered multifactorial. It's not one factor, it's a bunch of factors. So medical therapies for chronic illness basically ignore the underlying causes and treat the manifestations. So there are three main manifestations of illness: symptoms, you feel that, hormone imbalances, and inflammation. But the root causes of all of those things are cellular stress. But there are no medical therapies, zero, that address that underlying cellular stress. So what we're doing is artificially blocking hormone imbalances, inflammation, and symptoms. And if you're not getting to these underlying stress factors, people don't get well. So that's a big difference right there. So I'm focused on what's driving the cellular stress that's making this person ill. And if we can get to those root causes, then we're going to solve that person's problem, and they're actually going to get well and not end up in a state of managed illness.
100%. And we're going to put the link below for your site, vitalplan.com, as well as Dr. Rawls' new book, The Cellular Wellness Solution. So if you guys are listening, in the description, you'll see it right there at the top. So feel free to click on that and check out Dr. Bill's site and book. Now, I totally agree with what you're saying, right? When you look at conventional medicine thrives where the isolated root cause is isolated, meaning it's done. It happened one time. You fell, you bumped your head, you broke your ankle, you got in a car accident. The root cause is no longer happening. That's only about 10% of today's healthcare cost, right? When you look at functional medicine or natural medicine, we're trying to get to the root cause, because underlying chronic disease, it's like a mini car accident happening every single day where the underlying cause is not fixed. It's still happening in the background. And the drugs of choice typically block enzymatic pathways, reuptake inhibitor ports, HMG, coreductase enzyme inhibitors, and statins, beta blockers in different blood pressure meds, right? So it's nothing, where we're adding synthetic hormones on the hormonal side, right? We're not getting to the root. We're just trying to control symptoms, manage them, and hopefully over time, we don't need more drugs or higher doses, which then may create more side effects. And so when you're dealing with someone with chronic illness, how much does the infectious load play into that? And conventional medicine does typically throw a lot of antibiotics at stuff. So how does what you do on the infection side differ from a chronically ill patient than what you do on the mainstream MD side?
Okay. Well, let's define infection.
Yeah.
So first of all, an infection is when a foreign microbe enters the body for the first time.
Yep.
So if you have chronic symptoms, that's very different than that acute infection. So in acute infection, we typically feel symptoms like malaise, fever, and that sort of thing, because when the microbe comes into the body, there's this confrontation between the microbe and the immune system. And most of the time, the immune system wins the battle. But the fact of the matter is, it's happening a lot more than we know about. All right. So there are things that come in our body that typically don't cause symptoms. Most people that get bitten by a tick don't become symptomatic. And they think, well, I didn't get symptoms, so bacteria didn't enter my body. Wrong. And this idea that, well, some ticks have Lyme disease and some ticks don't is true, but all ticks carry hundreds of species of microbes, and we don't know about what most of them do. And every time you get a tick bite, something enters your system. But it's not just tick bites. It's intimate contact with other people. It's all the viruses and things that you picked up as a child. It's hamster bites and cat scratches. It's just things are happening all through your lifetime. Plus, right now, while you and I are talking, there are microbes crossing over from our gut and our sinuses and our skin into our bloodstream. And what all these microbes want is to get to our tissues, because basically our tissues, our cells, are food. They need to break down our tissues to get more food to grow microbes. That's what it's all about. So when we have this confrontation, the immune system is most important for fending off these new infections, foreign invaders, things crossing over to our system. But what I've learned, which is really fascinating, is that every encounter, some microbes make it beyond the immune system and they invade our cells. And this is a survival mechanism. If microbes can invade our cells, so that's the resource they want. They want to break down our cells to make food, to free up those organic molecules to make food to grow other microbes. But if our cells are healthy, what can happen, and this turns out it happens a lot, is the microbes can go dormant inside of our cells. So imagine that. Every microbe encounter you've had for your whole lifetime, you've collected dormant microbes inside of your cells, in your brain, your heart, in your joints, everywhere. And so as long as your cells aren't stressed, these microbes stay there. They stay dormant. And that's the key to understanding how all these chronic illnesses occur, chronic Lyme disease and everything else.
So I'm just going to play devil's advocate here, just so the average person kind of, can see it from both sides. So why isn't conventional medicine good at this? Because they're really good at prescribing antibiotics, even when there's viral infections, which antibiotics don't really address at all. Why aren't antibiotics addressing this? And are we having collateral damage from antibiotics with microbiome destruction? What's your take on that?
Yeah, that's the problem. When you look at antibiotics, they are built for one purpose, killing fast-growing microbes.
Mm-hmm.
That's it. So if you get a pneumococcal pneumonia, antibiotics are going to kill those fast-growing bacteria very rapidly. Pneumococcus turns over, doubling time is about 20 minutes. So they're growing really, really rapidly. They can make somebody sick very, very quickly. So antibiotics are very good for that. The problem is you're killing other things in your body too. You're affecting the normal flora in your gut and on your skin and throughout your body. So our normal flora play a very important role in our microbe defense in that they keep pathogens that we all have and suppressed. So we need our normal flora. So in as little as 10 days of taking an antibiotics, two things happen. One, you start depressing your normal flora and allowing pathogens to flourish in your gut, in your skin, all over your body. And two, you're starting to generate resistance to that antibiotic. So the pathogens that you're cultivating are starting to become resistant to the antibiotic. And that puts you in a really, really bad place. Now, these dormant microbes I'm talking about, the antibiotics don't touch them at all. And when they reactivate, they're growing very, very slowly, much slower than our normal flora. So it does take long-term suppression to bring them down. But if you do it with an antibiotic, you're going to destroy your normal flora and generate antibiotic resistance every single time.
And I see a lot of these even more natural doctors that are kind of part of this ILADS community where they tend to use a lot of chronic antibiotic, like for years at a time. With a lot of these Lyme or Lyme co-infection people, you start to deal with the idea that you have die-off, but then are you really just dealing with the consequences and the side effects of the antibiotics? But then it's told, well, that's just a Herxheimer's, keep going, keep going. But then is it really the antibiotics or is it really you're having die-off and you should keep going? So it's this kind of like, you're damned if you do, damned if damned if you don't, and you're kind of in between this rock and a hard place. How do you navigate someone that's put on that path with chronic antibiotic use and you don't know if it's helping or if it's die-off or if it's side effects?
There may be a place for antibiotics, but I think it's a very, very limited place.
More
I
acute.
tend not to use antibiotics. I did not, I took antibiotics early on. It's like, yeah, I finally got this diagnosis of
Yeah.
Lyme disease. I can take antibiotics and I can get well. And after several weeks, I was actually sicker than when I started. Every single time I used antibiotics, that forced me to start looking around, which ultimately caused me to use herbal therapy. And that was my ultimate solution. So when you look at herbs, they are a solution that fits the problem better than anything else you can do.
Do you ever recommend acute antibiotics, like an acute doxycycline protocol, like a 500 milligram BID for 2 weeks, if someone get bit by a Lyme, or if they showed a bullseye rash, which most of the time they don't? What's your recommendation on that?
Yeah, I think that's reasonable. This idea that antibiotics eradicate the microbes every time, I think, is bogus. There
Hmm.
is no evidence of that. That's just an assumption that a lot of conventional doctors make. There's
Hmm.
no evidence, and there's plenty of evidence to the contrary. I've seen too many cases. So I think with that tick bite, taking antibiotics is reasonable because the microbes have first entered the body, the bacteria have first entered the body, they're coursing through the bloodstream, they're invading tissues. And if we can decrease the counts of the bacteria,
Hmm.
then that helps give the immune system a leg up, number one. And two, that probably is going to reduce the numbers of microbes that actually make it to our tissues and invade cells.
Yeah.
So I think it's very important, but I don't stop there. I typically put people on herbal therapy for months
Yeah.
because the penalty for using herbal therapy is pretty close to zero.
I agree. Like, for instance, my wife, the start of last summer, had a tick bite. It was on her for a day or two. Our first line approach was we used some topical silver gel and some witch hazel. We hit that for a couple days topically, and then for the whole summer, for 3 months, I had her on astragalus, cat's claw, had her on the resveratrol, Japanese knotweed. See, there was a couple other. Sarsaparilla was another one. Andrographis was another one. Um, Cryptolepis and Sida acuta were a couple others. So we had her on this whole protocol for about 2 to 3 months, and then a little bit of reishi mushroom in the background to keep the immune system supported. I agree. It's better to take a long and steady approach, keep the immune system strong. Maybe you have some topical or oral antimicrobials, but then really bump up those natural killer cells so they can go to work and really clean down that microbial load.
Yeah, absolutely. I mean, that makes a lot of sense, but there is a specific reason why herbs are so valuable in this. And that is that when you take an herb, you're basically borrowing the plant's defense system.
Love that.
So all plants are producing a chemical network to protect the plant's cells from free radicals, from radiation, from toxic substances, but from every microbe imaginable. So we have a cellular immune system. Plants have a chemical immune system. Fungi have a chemical immune system. So we're not taking one chemical like an antibiotic. We're taking this spectrum of chemicals, and there's a certain intelligence built into that. And very interestingly, when I started herbs, I was taking things that I thought might have antimicrobial power. And I assumed that within several weeks, I would have the same response as the antibiotic. I would have bad gut dysfunction and everything else. Never happened. And the reason is that herbs, when you take an herb, even an herb with stronger antimicrobial properties, it suppresses pathogens, but not your normal flora. And that's really important.
Correct.
What that means is you can take herbs for a long time. I've actually been taking herbs continually for 15 years.
Hmm.
And that's just so remarkably important. Now they do have antimicrobial properties. All plants have antimicrobial properties. All fungi have antimicrobial properties. They have to. All living organisms have to defend themselves against other microbes, even bacteria. So all living organisms have some kind of defense system against microbes. So again, when we take an herb, we're borrowing that plant's system to reinforce our own. And there's plenty of good evidence that it works. There was a Johns Hopkins study in 2020 that showed some of the herbs you're mentioning, Japanese knotweed, cat's
Yep.
claw, and
Yep.
others. Chinese skullcap was on the
Skull
list,
cap. Yep.
actually worked better than doxycycline for suppressing Borrelia. There also have been a series of studies looking at Bartonella, Babesia, SARS virus, showing these same herbs have a broad spectrum of activity. So the herbs have some really remarkable antimicrobial properties. Now, somebody had acute pneumonia, I'd probably treat them with an antibiotic. But
Hmm.
most anything that has a chronic nature, I'm going to use herbal therapy. And if they're not responding, then you have to look at factors that their cellular health is poor and you're not getting the coverage that you need. So you might need to round out other herbs or focus on other parts of the therapy.
100%. People forget about 80% of your immune system's in the galt and the malt, right? The gastric associated lymph tissue and then the mucosal associated lymph tissue in the stomach and in the small intestine. So, if you chronically are blitzing your intestinal tract with antibiotics, you're going to negatively impact that microbiome, which is going to impact your immune system, not to mention more than likely create some kind of a fungal or candida overgrowth, which is also going to have a negative impact on your immune system too. And so we can't, forget about that. And then you mentioned some of the anti-inflammatory aspects of the herbs that are going to be wonderful. Plus, these are things that herbs have that antibiotics don't really address or called efflux pumps. People don't know about this, but efflux pumps essentially, if a microbe is a canoe taking on water, right? Essentially, the efflux pumps would be someone on that canoe bailing the water back out into the ocean, right? And essentially, the efflux pumps are like taking away that bucket out of that person in the canoe's hand, so the canoe can take on water faster and sink. And that's a property that many of these botanical herbs have that antibiotics don't quite possess. Not to mention some of the antioxidants, which are very important because if you just go on PubMed and type in antibiotic and oxidative stress and antibiotic and mitochondrial damage, you'll see lots of studies connecting that oxidative stress from mitochondriopathy to antibiotics, but you don't quite get that with herbs. Plus, you get the ability to kind of titrate. If you're doing a tincture or a smaller dose, you can kind of work things up if you're more sensitive on that side of the fence too, which I like.
Yeah, absolutely. All of those are important points. And yeah, there's a long list of why herbs are better, but when I look at herbs, I look at them as a cell protection system. And I think that's really important. Whether you're talking about antimicrobial properties or the other protective properties, every
Right.
herb I've studied has been documented to have anti-cancer properties. Most herbs have some properties that protect us from excessive carbohydrate consumption. And that's not a substitute for a good diet, but it can help. So these things are protecting our cells. And really, that's the core of getting well. So this idea of dormant microbes in our tissue, it is being labeled. If you do a search on PubMed, you'll find one particular study that scientists are starting to call this the dormant blood and tissue microbiome. And the idea that we actually have dormant microbes in our blood, in our red blood cells, in our white blood cells, in our brain, and throughout tissues in our body is pretty fascinating. And when you start looking at it as a model for chronic illness, it really provides this elegant explanation for everything. So you can have these things. They can be present your whole life. I got bitten by ticks when I was a child and picked up all kinds of stuff. Mycoplasma, Epstein-Barr virus. And these are just the ones we know about. The ones we know about are just scratching the surface. So these things stay dormant inside your cells, but cellular stress, eating a poor diet, not sleeping enough, chronic exposure to all the toxic substances we are, or mold, being sedentary and not, having the blood flow you need to flush away all that buildup of toxic waste around your cells, then your cells are weakened. And when your cells are weakened, the microbes reactivate, emerge from cells, different tissues in the body, and start causing symptoms. Symptoms are damage to cells. And so you have different symptoms in your body, but plays out differently with different illnesses. People pick up different microbes. They're exposed to different stresses. We have different genetic factors that allow reactivation of microbes in various parts of the body. And that really starts to explain all chronic illnesses. But drugs aren't a solution for it. And that's why you don't hear conventional doctors talking about it, because they don't have tools to fix it.
No, when it comes to the chronic illness department, they're definitely off there. Plus the insurance model, spending 3 to 5 minutes with the patient, it's not really enough time to really get the data you need to be able to
That's
make the
right.
diet and lifestyle changes. I want to dive into that in a second. When my wife got that tick bite last year, we sent it to a lab too and had it PCR analyzed for microbes. It came back with nothing. What's your thought on saving your tick and trying to have it analyzed and see if there's any microbes specifically on it?
When it comes to microbe testing and testing ticks, in from an academic point of view, I think any testing and the more we know is better. I mean, you
Mhm.
think about it, 50 years ago, we didn't know that Borrelia caused an illness called Lyme disease.
Right.
Nobody knew about that.
Right.
And then over the years, we've started defining all of these other pathogens that are present in ticks. Well, they found that one tick species carries over 237 different families of bacteria.
Yeah.
That's hundreds of bacteria. And we don't know most of them, what most of them do, or their potential for harm. But what I can tell you is all of these things that we're talking about are low grade pathogens. That
Correct.
surprises people when I
And if
say
your
that.
immune system's strong, you probably could overcome it without a problem. But when you have all kinds of other stressors and you're a little bit more compromised, then that's where that chronic illness situation could set in.
That's right. Because even if you don't have symptoms of a tick bite, some of those microbes can get through and become dormant in your tissues and they can reactivate later. So, the more tick bites you get, the more exposure. But quite frankly, we're exposed to a lot of different things. And what I can tell you is that people can have virtually the same symptoms of chronic Lyme disease and never have been bitten by a tick or exposed to those particular microbes because there's so many other things out there. And again, we're just scratching the surface.
100%. Now, you mentioned coagulation and blood flow earlier. I want to kind of dive down that path a little bit because we know a lot of these herbs and nutrients, you need blood flow to get them into the tissue so they can be exposed to these microbes to modulate your immune system. What are some of your strategies to improve coagulation decrease coagulation? That means clotting and improve blood flow. What does that
Yeah.
look like to you?
Well, coagulation, we see this happening with illness, right? Okay.
Inflammation.
So what's happening there? Well, that theory on the dormant blood and tissue microbiome actually gave some suggestions on that. And actually, I found half a dozen studies that have been done around the world that did RNA recombinant testing to look for dormant microbes in red blood cells of healthy people. And what they found was every sample, every single sample in every study showed dormant bacteria inside red blood cells in healthy people. And they sourced them, interestingly, not mostly from the outside of the body, but from the gut and from the skin. And we know that things are crossing over these barriers, our gut barrier, our skin barrier. They're crossing to our gut bloodstream. And again, a survival strategy is dormancy. So if you're healthy and you've got good, healthy blood cells, then they stay dormant. But if you are stressed, all these stress factors that I talk about, then the microbes start reactivating. So think about this. If your microbes are dormant and your cells are healthy, that's what wellness is. When your cells become weakened, these microbes can reactivate. And when they reactivate, what their strategy is breaking down cells and breaking down tissues to form to basically generate food to grow more microbes. Well, that's what's happening in the bloodstream. So when everything is weakened, your these microbes in your blood. This is the theory that's outlined by that study, is that the microbes reactivate and start breaking down red blood cells. And
Mm.
that activates coagulation factors, which clump the red blood cells. So you've got this broken down red blood cells that are clumped together. Well, that forms a perfect environment for microbes to grow, for bacteria to grow. So that's basically what's going on. So we do see that and that anemia of chronic illness, the coagulation that occurs when somebody's really, really sick, is explained by that phenomenon. of the microbes, but because most bacteria, not Borrelia, interesting, but most bacteria need iron. So if the
Right.
cells are healthy, they can't get to the iron. But if the cells are unhealthy and they can break the cells down and clump them together, then they can start building out more microbes. As far as tissues go, yes, when we have poor cellular health, we have constant cellular die-off. Now, cells are dying all the time. We're dying, cells are dying, we're replacing them. We lose about 1 billion cells a day. But
Wow.
if you have excess cellular die-off, think about it. All your cells are kind of compacted together in tissues, like in your heart or in your muscle. So if you have increased cellular die-off, that creates debris, and that congests the spaces in between your cells, so cells can't get good blood flow or flow of nutrients and oxygen, but they also can't purge waste. They can't get rid of waste. So the solution to pollution is dilution.
Yep. Good hydration.
Exercise, and if you can't exercise, sauna is really good for flushing away those
Yes.
spaces. That's the first and most important step of detoxification, is giving that flow to allow your cells to purge those toxic substances and clear away that waste. And when we look at chronic inflammation, what's going on is when you have all that extra die-off and debris, the immune system sends in cells called macrophages to clean
Hmm.
up the mess. Well, they use potent acid and free radicals to break all that debris down. So if it's going on to any significant degree, that becomes a toxic stew that your cells are bathed in.
100%. So we need good hydration. Along with that hydration, if we're eliminating a lot or sweating a lot, we could also be pretty low in electrolytes. So making sure we're on top of our sodium, our chloride, our potassium, magnesium sounds like it'd be also very important. You talked about sweating. Where do you incorporate binders to kind of help, bind up some of these toxins so we can eliminate it so it doesn't kind of re-go back and, repopulate the circulation again once you've kind of headed down that excreting pathway? What does that look like?
The most important binder I suggest to people is eat more vegetables than anything
So good
else,
fiber.
because vegetable fiber
Hmm.
is actually promoting normal bowel movements, and it's a great binder. When you look at charcoal, bentonite clay, those kinds of things, what you're doing is actually slowing motility down in the gut. People can get constipated from it. So that first step in detoxification is blood flow, increasing blood flow. And if you want to take something that expedites the process, I like chlorella, because
Hmm.
chlorella is actually, you're absorbing the chlorophyll, and the chlorophyll is actually binding some of those things in that extracellular space and helping clear them through the lymphatics and sweat and through the bloodstream. I know about the sweat part because when I was just exploring different kinds of things, I took a lot of chlorella. I started sweating green. So, yeah, you get it all through your body. But that's helping to pull those things away to get them to the liver where they can be neutralized. Now, once the toxic substances are neutralized, it's not a flood. It's slowly trickling into your GI. So you need something continually there. And the best thing for that is just vegetable fiber or other fibers like pectin and apple pectin and things like that to help pull that thing through and to make sure that you're stimulating normal bowel movements to increase mobility to get things out of your body.
Yeah, I always tell patients if we're using a binder, we got to make sure our bowels are doing good, and you're eliminating your bowels at least every 18 to 24 hours. I think that's really important. What supplements to help improve coagulability? We didn't quite hit the specific supplement side of the fence. What do you like there?
Well, anything that improves cellular health. I mean, the herbs are going to do a great job of that too.
Anything in
And
particular, like ginger or like systemic enzymes, things like that? Anything like that you like?
the herbs are first on my list because they are doing
Mhm.
so many things for cellular health.
And by herbs, can you just kind of hit the top three?
All right, Japanese knotweed,
Resveratrol.
Chinese
Good.
skullcap, cat's claw. Throw in some cordyceps and reishi. It's a
Mm,
really good combination
love
right
that.
there. But so the herbs are doing a lot. So all of those herbs are going to have some anticoagulation properties. They
Okay.
inhibit platelets, so they keep that clumping from happening. So I think that's really important. When you look at the overall picture, you mentioned enzymes like nattokinase and
Yep.
serrapeptidase
Yeah.
that they're breaking down fibrin, which is part of that clotting mechanism. One of the best blood thinners I know of is krill oil. Krill oil is
Mm.
great.
Yeah. Fish oil in general, right?
I
Too.
did a self experiment. I wanted to see how much the average male, this was when I was well, how many krill tablets, capsules it would take to get to the point of thinning my blood. And you can monitor that. And I don't suggest that everybody do this. I'm a physician, and I wanted to learn. So I
Real
was
quick, what was the
pricking my
lab marker?
finger. Just
Was it a D dimer or a fibrinogen? What marker were you using?
I was just pricking my finger.
Oh, okay.
Pretty
It's
easy.
not a lab marker.
Yeah, it works. That is your best coagulate, but blood bleeding time is more important than anything else. I mean, that gives you more information. You just prick your finger. You can get a lot of information without doing a whole lot of work.
Are you milking
Um,
it all, or are you just letting it run?
well, I didn't really let it run too long, but I was up to about 5 or 6 capsules, and then it was like, yeah, that's getting pretty thin. So I backed off to 3. So 3 was perfect for me. But my wife, she bruises with 1 capsule. She has to be really careful. So it is a little bit individual. But so I think average 1 to 3 capsules of krill, but it appears that krill does a better job of helping than fish oil because it's a phospholipid instead of
Phospholipids.
a triglyceride. So we can absorb it better, we get more of it, and it has a little bit better blood thinning properties. But it's
Less
excellent
EPA and
for blood
DHA though.
thinning.
It's more the phospholipids that kind of have that therapeutic benefit.
Yes. Well, all of our cell membranes are phospholipids, right?
Right. You get the lipid
So
bilayer.
it's absorbed easier through the gut and it's incorporated easier into our cell membranes where it can do some good. But also how it affects uh, particles like LDL particles and things like that. The lipoprotein is going to affect it differently than the triglyceride. It's going to be more soluble. It's going to affect particles differently.
Is there any application that you would prefer fish oil over krill?
Hmm, yeah, I'm sure you could find one, but if I had to choose one or the other, I look at all the different variables, and krill wins overall.
Very good. You described it really uniquely. You said you're borrowing the plant's defenses. They're immune defensive when you take on that herbal support. You're borrowing their immune defenses. I never heard someone explain it like that before. That
Yeah,
really resonated.
yeah, yeah. And it's more than just the plant's defenses, right?
Go ahead.
So
Yeah.
plants are using a lot of the same chemical messengers that we are. So we're a multicellular organism. So all of our cells, for us to function as a unit, all the functions of all of our cells have to be synchronized. And that's basically what nerves and hormones are doing. And other signaling agents, we even use photons for signaling between cells. All the cells in the body have to talk to all the other cells in the body for us to function properly. And the brain is working to sense everything going on outside and inside and regulate those cellular functions to synchronize so we're matching the stresses that we need to function. So plants have to do that same thing. Plants have to coordinate all of their cellular functions. So they're using a lot of the same chemical messengers that we are. So it's not surprising when you take an herb like passion flower or different kinds of herbs that it's going to have some effect on our hormone systems. Now, so different plants have different effects because different plants are dealing with different stresses in their environment, and they choose to solve that problem in different ways. And sometimes it's not compatible with our body. It's like nobody would try to take poison ivy for health benefits, right? But most plants, the things that we define as herbs, are things that humans have been using for thousands of years. So we've found that they have this compatible ability to our body and they can provide benefits. But different herbs have different effects. So when you look at the adaptogens, there are two ways that they're reducing stress. So adaptogens are herbs or medicinal mushrooms that make us more stress resilient. Well, they're doing that one by protecting our cells from stress, which makes us more stress resilient, but they're also balancing our stress hormones. Taking that healthy plant gives our brain feedback that it calms down some of those stress hormones, so we're not pushing that stress button quite so hard.
Very good. What are your top 5 favorite adaptogens?
Yeah, rhodiola is a really good one
Yeah.
for recovering from chronic illness. I like reishi and cordyceps; they're
Yeah.
exceptional. Interesting, we talked about Japanese knotweed and Chinese skullcap, cat's claw, some of those herbs. They all have some adaptogenic properties that are really
Mm.
interesting. They all have anti-cancer properties. They do a lot for your system. Um, but yeah, rhodiola, reishi, cordyceps. There's one called Gotu kola that's really
Coca-Cola,
good for your
blood flow.
brain. Lion's mane is great for your
Mm.
brain.
Memory, yeah.
Schizandra is a really nice adaptogen.
Yeah.
I
Cassandra.
tend to gravitate toward things that aren't stimulating. Some adaptogens, the classic adaptogen is ginseng, but it's very, very stimulating and
Yeah,
it
it can be.
tends to interrupt sleep for a lot of people that are recovering from an illness. And the same thing with Eleuthera, which is a really nice
Yep.
adaptogen, but it's a little bit too stimulating for most
Mhm.
people. Rhodiola, little bit stimulating. I tend not to use it for people recovering from chronic illness, but if you're healthy, that little bit just yeah, it can really make you feel good.
And how do you recommend some of the herbs or adaptogens that you do? Is it just based on your clinical experience? Do you do any muscle testing? How do you prioritize how many someone should get or not?
I never learned to do muscle testing. I
Mhm,
think there's value in that, but
mhm.
it's and it is a little bit of a trial and error. But what I find is these herbs that I would define as everyday herbs, these are herbs that are mainly have uh, cell protective properties or stress reducing, balancing properties. Most people tolerate them quite well. Of course, that doesn't describe all herbs or all plants. You can move out to an area where you're getting plants that contain phytochemicals that have more drug like properties. Um, and a lot of people are looking for those drug like properties because they want to solve a problem. They want something that either puts them to sleep or stimulates them or something to get an effect from the herb that's more of a drug like effect. I tend not to use those as much, and people tend to have more side effects. The more drug-like your herb, the more side effects and potential for side effects that you're going to have. All the way out to the fact that more than half of our drugs actually come from plants.
Yeah.
And the interesting thing, though, is a lot of people hear that and they go, oh, well, they're pulling chemicals from all these medicinal herbs that we're taking. No, they're not. What they're looking for are things that poison reactions in the body. So they're looking for plants that are basically poisons. They're looking for things that kill cancer cells or interrupt enzymes or some of the things that you mentioned.
Typically, yeah.
And so they're looking for a plant with a poisonous effect that we can pull that particular chemical that has that effect and use it therapeutically. And there is value in that.
Yeah, for
I would
cancer.
say there's a place for every one of our drugs, but we're too reliant on drugs and we're not using them to promote cellular health and wellness.
Yeah, so I was talking to a organic chemist that worked for a major drug company, and I said, because he was working on a lot of the research and pipeline drugs, and I said, "What percent of all the drugs that you're working on, you are looking at different herbs or botanicals and trying to take some kind of an isomer to make that a patented drug?" He's like, "70% of the drugs we're looking at are coming from plants." That's a big thing. Now, again, that may be good at certain levels if it's less toxic, right? Because the problem with a lot of different drugs is they can be very toxic, and if you can use a plant that's less toxic, maybe it's a little bit different. But then it's like, well, why don't we use the whole plant itself, right? So it kind of begs the question, right? So that makes a lot of sense.
Yeah. Well, it's a big part of pulling a particular chemical is that you can synthesize that chemical and then patent it. So
That's
I
yeah,
think it's
patentable.
important
Mhm.
to recognize that, again, when we start talking about antibiotics, I used to think that there were just these really brilliant scientists that sat in a room and they designed these chemicals that had these antimicrobial properties. Not even close. We're just not that smart at all. All antibiotics originate from a natural source, either a plant, a bacteria, or a fungus.
Yep.
Funguses are especially good because funguses are constantly having to fight off bacteria and they're producing a lot of antimicrobial substances.
Correct.
And so, but they don't take the organism's entire system. It's not the whole bacteria system or the plant system or the fungus's system. They're pulling one chemical that they can potentiate and
Make
patent.
it more therapeutic,
And
right?
that's
Patent it.
really important. Yeah, and there's a certain amount of being able to do a targeted effect.
Mhm.
So from our drugs, we want this targeted effect, which can be valuable. You look at the drugs for chronic illness early on when somebody's in a really, really bad place. That medical therapy can be very important for stabilizing the person's condition and keeping them from dying. But if you just keep doing that, the person isn't ever going to get well.
Makes sense. Plus, with a lot of these herbs, you're going to get different bioflavonoids. You may even get biofilm disruptors, antioxidants that are also going to come in there and support the antimicrobial action of the plant as well. So it's kind of like a package deal where you're getting all these synergistic cofactors with it. Where if you're just pulling an isomer out, trying to patent it, you're going to miss all these other synergistic compounds that are around that plant too.
Yep.
Makes sense. Well, I want to hit a couple of rapid questions here before we let you go. Any other modalities that you find beneficial with for the chronically ill patient? You mentioned sauna. Is that infrared sauna or is that hot sauna? Also, any other thoughts on other modalities like cold plunges, cold therapy, PEMF devices, red light? I just kind of want to go down the top 5 or so modalities for you that you see as being beneficial.
Yeah. I've looked at these things for years, and my foundational thing is always herbal therapy. I think that
Mhm.
should be cornerstone of
Yep.
any recovery. And beyond that, the person really does need to adopt those practices for cellular health: good diet, clean environment, low stress, plenty of sleep, getting plenty of exercise. But beyond that, can you do anything to accelerate it? And the things that I'm looking at are things that might have the advantage of promoting cellular health. So brain retraining, there are a number of different options for that. Can calm that sympathetic
Yep.
overload that's really, really driving a lot
That's
of
very good.
chronic illnesses. I mean, you think about it. So, what a symptom is, there are two things, there are two components of a symptom. One, when cells are stressed or injured, like if you cut your finger,
Hmm.
you damage cells, they release chemicals that activate nerves that tell your brain something's wrong. The second thing is, like if you sprain your ankle, you've damaged cells and you lose that function. So, what healing is the ability of cells to regenerate, but that takes time. So, in the short term, symptoms can be a big problem. Now, think about somebody who is chronically ill, who has cells that are in distress all through their body, constantly bombarding the brain with these distress signals. It causes that overactivity of that fight or flight response, which works against us because it messes up our sleep and messes up our GI tract and everything else. So, brain retraining to enhance the vagal response to calm the sympathetic overreactivity can be really beneficial for someone in chronic and that it's recovering from a chronic illness. PEMF and red light therapy, especially, we know that low level energy is actually energizing cells. It's providing more energy for mitochondria to function. So when cells have more energy, they can recover. That's really important.
Mm.
Of the two, the best data I've seen is red light therapy.
Hmm.
They've actually demonstrated that the photons are energizing mitochondria within cells, and it's good for brain functions. It's good for virtually everything in the body. And along with that, cold laser is basically the same thing. So red light therapy can be really beneficial. Sauna of any kind, I think, is fine.
Hmm.
I think the big deal with infrared sauna is that it's very, very convenient.
Penetrates
I
deeper too,
mean,
maybe.
you can have a sauna, infrared sauna unit shipped across the country. You snap the panels together, you plug it into a wall socket. Hey, you're good to go. Whereas regular sauna is quite a bit more complex, and you have the moisture issue that you're having to heat the air instead of radiating the heat into your body. But basically, what you're doing is heating up the body, and that increases blood flow. So it's another way to flush your tissues and pull out those toxic substances, help your cells purge toxic substances. So there are quite a number of other things out there. Seems like there's a new therapy that pops up every day,
Hmm.
and I try to look at it with four variables. The first is efficacy. Is there some kind of information? And the best is scientific information, but if there's not much science, but you've got several 100,000 people that have posted on the internet that they've gotten benefit, yeah, that's something worth looking at.
Yeah, that's pretty
So
good.
efficacy. The second is safety. What's the penalty for doing that thing? What's the potential for
Right.
harm? How much could it hurt you? The third is cost. If you've got something that, we don't really know that much about it, we are not sure if the safety profile and it's going to cost you a big upfront cost, better go back and look at that one again.
Right.
And the fourth is it supportive or is it completely therapeutic? It's like
Right.
herbs and that lifestyle change. I consider that therapeutic as far as total therapy. Whereas red light therapy, I see that more as supportive. It's helping out. It can relieve symptoms. But all of those things are good.
Very good. Any last question here? Any foundational diet changes that you recommend that are a little bit different or a little bit more nuanced than the typical functional medicine doctor?
I've tried to get it down to easy, and I've got it down to four basic points, and
Mm.
that try to follow every day. First is trying to eat a whole food diet.
Hmm.
Whole foods are whole cells. It's like an apple is full of carbohydrate, but all that carbohydrate is contained inside cells. And the parts of all of those cells are the nutrients that your cells need to function. Compare that to a donut that is just raw carbohydrate and fat extracted from seeds. You don't get the same effect. So, whole foods are really important.
Yep.
Can't do that with everything, but as much as you can. The second is eat more vegetables than anything else. It doesn't matter
Yep.
how you describe it, vegetables are really important. But vegetables don't have much carbohydrate and fat. And that's one of the
Hmm.
reasons they're important. So they don't taste good. So you have to learn how to incorporate vegetables to make them taste good. The third is try to keep your carbohydrate counts down. And
Yeah.
I don't follow ketogenic. I think ketogenic can force people into bad dietary habits. But I try to keep my carbs around 150 to 200. Um, and that's enough to add enough carbohydrate to make life comfortable. I can have an apple. I can occasionally have a piece of bread when I go out to eat or something,
Hmm.
as long as I'm keeping that total carbohydrate count during the day. And I check it to keep myself honest. I do a hemoglobin A1C every 6 months. My last one was 5.0, which shows that I'm
Hmm.
not eating enough carbohydrates to damage my cells. And the fourth is this concept of intermittent fasting, which is just getting circulated around in a lot of different ways. Some people are just eating one meal a day. But I think the idea of giving your body at least 12 hours, for some people, they can go to 6. Other
Yep.
people, that's difficult, but at least 12 hours just to digest your food. And that promotes autophagy, which is the process of cellular repair.
Any philosophy on protein consumption, and how much?
You don't really need a ton of protein. I think most people are eating more protein than they need. They think, wow, protein is really great for you. Well, we do need protein because protein is important for us to build muscles, to build enzymes. Everything works in the body from protein. Um, but yeah, you need about 100 to 200 grams a day. That's not a huge amount. Here's the penalty for a high protein diet. So proteins contain nitrogen. So when you break down proteins and start burning them for energy, which if you're eating more proteins than your body is using to replace proteins, you're burning it as energy or you're converting it over to fat. When you do that, you split off the nitrogens. That's ammonia. And ammonia is really toxic to your cells, to your kidneys, and everything else. So high protein diets generate a lot of ammonia, which isn't necessarily good for you. The other problem with a high protein diet is that when you metabolize the protein, it generates acid in your tissues. And that day, your blood and your tissues have to be maintained at a very, very narrow pH that's right around 7.4 all the time. You have to do that. So if you're eating a lot high protein diet, lots of grains, that sort of thing, you're generating acid in your tissues. So you're pulling bicarbonate, carbon from your bones to neutralize that acid. So high protein diets have been associated with osteoporosis. You're pulling calcium, you're leaching your bones to neutralize the acid. So high protein diets are associated with, if you're eating a lot high red meat diet, it's associated with increased risk of colon cancer, kidney disease, and osteoporosis.
All right. Well, thanks for the feedback, Doc. I really appreciate it. Head over to vitalplan.com. That's Dr. Rawls' website. And then Dr. Rawls' new book is what's the title? Cellular Wellness. I had it up here on my phone.
Cellular Wellness Solution.
Cellular Wellness Solution. We'll put the link right down below in the description. Dr. Rawls, anything else?
It's been a pleasure. Thank you so much for having me.
Excellent. Nice chat with you, Doc. You have a good one. Take care.